Good morning, everybody. Can I thank the more than 68,000 people across New South Wales that came forward to get testing? That is outstanding. It's off the back of a number of days of high testing rates, and that is really important for us to be able to tell to what extent we've captured the virus in the community. So thank you so much to all of you coming forward and getting tested, but thank you also for the staff. We know that many staff out in the cold, wet weather have been working long hours to make sure we test as many citizens as possible, and I just want to thank everybody involved for the great work to date. Overnight, New South Wales had 22 cases of community transmission, so New South Wales is demonstrating a steady rate of cases at this stage. To date, our fears about huge escalation haven't materialised, and we certainly want to keep it that way. One other pleasing thing I do want to report on is half of those 22 cases were already completely in isolation. So 11 of those cases were in isolation. 5 of them were in isolation for part of the time they're infectious, but 6 of those were still infectious in the community for a number of days. Now, what we want to see moving forward in terms of positive trend is a higher proportion of people in isolation for the full time of their infectiousness. Now, that's something our health experts will be looking at. Dr. Chant advised us that's one of the key things that health looks at when talking about the success of the lockdown. So what's really important is for all of us to keep doing the right thing, because if we keep doing the right thing, everything we hope to achieve can be achieved in the time frame that we've discussed. So please know that if all of us continue to work hard together, we can achieve what health wants us to achieve, what all of us want to achieve in the time frame that we've discussed. I know there's a lot of commentary on a lot of states across Australia are facing some level of lockdown or some level of restriction, and I appreciate every state leader has a particular direction for their state. So I just ask New South Wales citizens to please keep following the advice that Dr. Chant has given all of us, that Dr. Chant provides to me and the government, because that is our assured way of seeing this lockdown end when we'd like it to end, and also our assured way of dealing with this very infectious strain of the COVID-19. Today, Minister Dominello is here from Service New South Wales to outline some additional requirements we'll be asking businesses to do, businesses that currently don't have QR codes, including takeaways, to make sure that when we finish the lockdown, when we emerge from the lockdown, that we have those extra measures in place to make sure that we're completely covered with this new, more infectious strain of the virus. Now, we know that we do need to think about things a bit differently when we come out of the lockdown, and we're already starting to think about what life will look like between coming out of the lockdown and also once the majority of our population is vaccinated, because in that intervening period, we know this very contagious strain of the virus is something we've not dealt with before in this way, and therefore we will need to consider what COVID looks like, or what COVID life looks like, between coming out of the lockdown and also when the vast majority of our population is vaccinated. But I just want to urge all of our citizens to keep doing the right thing, because it's working. If all of us stick together and continue to do the right thing, we will hopefully see those trends continue with a greater proportion of those cases identified in isolation. Health and we don't worry about those cases that have been in isolation the full time of their infection, because we know they haven't been out and about in the community. And whilst venues of concern have increased overnight, we're also expecting that to taper off, because if you look at the dates where those venues of exposure occurred, they were before we went into lockdown. And we certainly hope that if people are doing the right thing, if people are staying indoors unless they absolutely have to, well, then those venues of concern will start to reduce in coming days, and that's something we want to see as well. So I just want to thank everybody for your efforts. Just remind everybody that if we continue to do the right thing, if we make sure we're following the health advice, that we can get out of this in the time frame that we've described, but that depends again on the next few days. It's early days. So you might hear people commenting or giving their opinion, or people surmising about what may occur. Well, nobody knows, because the truth is in the numbers. The truth is in the cases. The truth is in the results that we achieve. And the secret of our success, or the measure of our success, will be to make sure that as cases emerge And we know the numbers will bounce around. We are still expecting a bounce up, but the numbers will bounce around. As cases emerge, the proportion of those cases who've been in isolation for the full time of their infection will be a measure of our success moving forward, and that's what we want to see. So thank you again to everybody. I will ask Dr. Chant now to give the health update. Deputy Commissioner Warboys will remind everybody about the importance of compliance and how important it is for all of us to do the right thing. Minister Dominello will talk about the new changes to QR codes, additional changes which will come into effect from the 12th of July, and then we'll take any questions. Thank you.
Thank you very much, Premier. So New South Wales recorded 22 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. All of these 22 new cases were linked to previously confirmed cases. 6 new cases were acquired overseas, and as the Premier had indicated, what a magnificent turnout for testing, that 68,220 tests performed. We're going to need to sustain those levels of testing if we are going to assure ourselves that we're not missing unrecognised chains of transmission. So of today's new locally acquired cases, 11 were in isolation through their infectious period, and that's pleasing to see. So one of the key indicators, as the Premier has indicated, is we're hoping to see that people are in isolation for the infectious period and therefore posing no risk. Also, the purpose of the lockdown is that when we do find those unrecognised cases, what's actually transpired is they haven't been to any of those Ways Hotel, our public health advice has been updated. So all patrons and staff who are at this venue from the 23rd of June to the 27th of inclusive is a close contact and must immediately get tested and isolate for 14 days regardless of the result, and call the 1800 943 553 unless you've already been contacted by New South Wales Health. The reason for that is we believe that there has been infection that has passed on to staff at that venue or infectious people there on multiple days. There's also 3 new cases linked to the Christo Pizzeria in Paddington, bringing the total number of cases linked to this venue to 4. I want to also highlight some of my other venues of concern where I want people to pay particular attention. But again, I urge everyone to go to that website for updated information. So as I've said, the Paddington Christo Pizzeria at 224 Glenmore Road on Monday, the 21st of June from 5:55 p.m. to 8:30 p.m. Kensington Doncaster Hotel on Wednesday, the 23rd of June, 5:45 p.m. to 8 p.m. Now, we have seen additional cases arise from that venue and cases in staff, and that means that those staff are more likely to infect other staff, and there's potentially exposure at that premise, which has gone on for longer over that duration. So we'll be keeping a close eye on the Doncaster Hotel. In relation to the Crossways Strathfield, I'd already indicated that there's ongoing transmission over a couple of days, so we have extended the period. So anyone there from the 23rd to the 27th, anytime, please immediately isolate and stay in isolation for those 14 days and get a test. In terms of other venues, a new venue, the Auburn Central on the 28th. If you've been there at any time at that Auburn Central, I want you to immediately stop and stay. And whilst we assess that venue, so that means please immediately go into isolation, get a test, and await further advice. And also the Marconi Club at Bosley Park on the 26th of June between 3 to 6 p.m. You are deemed a close contact if you have been in the gaming room, and all others, please get tested and isolate until you have a negative test. I also just want to discuss one other case that came in overnight. So just for clarity, we only update on the numbers to 8 p.m, but obviously we release venues of concern or highlight particular issues today ahead of the numbers being announced. So last night, one of the cases that occurred very, very late last night, came in around 10 o'clock till 11 o'clock last night, was a 24-year-old female who is a student nurse. We know that the student nurse worked whilst infectious on a number of days, and obviously immediately our health team swung into actions. And can I thank those staff who were working in the wee hours of the morning to ensure that patients were tested and staff were tested. So the wards that staff member worked at have been locked down, so that's not taking any additional visitors, any additional patients. We have also followed up any patients that have been discharged from those wards. We're also arranging testing for any staff that may have come in contact. I'm pleased to say that to date, the tests have been negative, but it's much too early to tell whether we'll have any transmission. And we've taken a very broad infectious period because of our concern about the vulnerability of healthcare settings. If I could just make another couple of comments around the vaccine. Please go and get your second dose of AstraZeneca. If you've had your first dose of AstraZeneca, get your second dose. We know that both vaccines, the Pfizer and the AstraZeneca, afford very significant, substantial protection against hospitalisation. But we urge you to get the second dose. So please book in to see your doctor. And also we're encouraging any elderly people that are eligible to please go ahead and commence their vaccination. Thank you. There were two hospitals involved. It was the Fairfield Hospital and also the Royal North Shore Hospital. There will be communication to patients. I suppose I will indicate the wards just so that there's no concern. It is a rehabilitation ward at Fairfield, and I'll have to give you the exact details of the ward, but there was a cardiology ward and a general abdominal surgery ward. Could we please just ensure that relatives are not concerned at this stage? We will communicate with you, but obviously due to the interest in this, that's why we're discussing it. But as you know, our preference is always to tell people directly when these matters happen. So we will be following up with additional information.
Thank you, Dr. Chan, Premier, Ministers. The last 24 hours has seen 59 infringement notices issued to people contravening the public health orders. The vast majority of those, 43 of those, have been on the public transport system, which is disappointing. We know that is a vulnerable place in terms of people gathering together. We really encourage people to make sure that they wear a face covering, a mask, whilst they're on the public transport system. Our police will see this as a priority over the next 2 or 3 days. What I also want to make very clear is that police right across country New South Wales are very much around people taking holidays and moving into country New South Wales for that purpose. The public health order is very clear in this regard, and what we want is for people to adhere to that, not move into country New South Wales on a holiday or try and disguise that holiday with some other business. What we've found is that people right across country New South Wales are ever willing to see who is in their community, to dob those people in through Crime Stoppers, and police will take action. In the last 24 hours, we've seen a man travel from Sydney to Tweed Heads, where he was spoken to by police and issued an infringement notice up there and told to return back to the Sydney area. In normal times, country people would welcome visitors to their area, but this is not normal times. We want people to make sure that they look after their own safety, that they look after the safety of not just people in Sydney, but right across this state. Thank you.
Well, the Service New South Wales app has been an important response to the COVID outbreak. From the 1st of January this year, we've had over 5.5 million people in New South Wales download the app, 330 million check-ins. We've received feedback over 8.5 million times with a satisfaction of 95%. But we've seen with COVID how fast it moves. Delta moves at lightning pace, so we need to adjust our circumstances accordingly. As a result, from the 12th of July, a whole range of other venues will now be required to ensure they have the Service New South Wales QR code in place. Now, I've already spoken to the major retailers and supermarkets and have expressed my clear indication that I expect them to put that system in place as a matter of urgency. They don't need to wait until the 12th because there's already a lot of through traffic going through those venues as we speak. But there are a number of businesses that are shut down during the lockout period, so we're giving them until the 12th in order to get their house in order. But from that point forward, everybody should be on the system. And can I express my thanks and gratitude to the businesses that are doing the right thing. It is hard for them, but this is a compact between businesses and their customers. The customers are doing the right thing, but occasionally some aren't. So we need to make sure that we're all working together to get through this. Thank you.
Minister John Nella, just quickly, when were you deemed not a close contact? Because you were deemed a close contact
on Saturday.
What was the situation that led to that?
Minister Marshall came into my office at about 3:30. He was there for about 2 minutes. He spoke to one of my staff members. He was around 3 metres away from me, so I was at a point when he wasn't that infectious. And I just followed the health advice. When they asked me questions about it, they said, you are now being casual.
Was the nurse vaccinated?
I'm not aware of the vaccination status. I would have to check, but I'm not aware she was vaccinated. But these are matters we'll look into. Obviously, we're encouraging our frontline health workers, particularly through our EDs and those that would be coming in contact with COVID patients, have been a real priority for our vaccination program.
Premier, we've just had a pretty explosive press conference in Queensland. Premier,
I hope we don't have that here.
we'll try and Premier Palaszczuk claims no agreement was reached by National Cabinet to vaccinate adults under 40 with AstraZeneca and has insinuated the Prime Minister has gone out on a limb here. What exactly was agreed to regarding under 40s getting AstraZeneca in National Cabinet?
Look, can I just make the point that the New South Wales government always follows the health advice, and the health advice from the federal regulatory bodies is that those over 60 should be getting AstraZeneca. If you've had your first dose of AstraZeneca, you should be getting your second dose, and that's certainly what New South Wales health clinics will be doing. We will accept anybody over 60 that wants AstraZeneca. We'll also accept, of course, anybody getting their second shot. But beyond that, you should talk to your GP. The federal advice is there, and beyond that point, you should talk to your GP. But can I also make this point? I am so deeply grateful to the GP network in New South Wales. They have tried their hardest under very difficult circumstances. Minister Hazzard, myself and our health team stay close to the GP network in New South Wales, and I share their frustration. We need to make sure that they're aware of everything going on so they can provide that advice to their patients.
Does that mean that New South Wales health clinics will not be vaccinating people with their first dose of AstraZeneca if they are under 40? Because you did.
Yep, the New South Wales health system will continue to welcome people over 60 that want the AstraZeneca. Will continue to welcome people who are having their second shot of AstraZeneca. Beyond that, you must go to your GP and get their advice. And what we need to do as a state government is follow the federal regulatory health advice, which is that AstraZeneca is offered for over 60s, and obviously second doses are strongly advised. As Dr. Chant and I have been saying for days since we had this most recent outbreak, it is so important to get your second dose of AstraZeneca if you've had your first one. And of course, if you're over 60, you don't have a GP, you're welcome to come to any of our New South Wales health website sites. But anyone under 60 who wants AstraZeneca needs to have a conversation with their GP.
Does that mean you agree with Anastasia Palaszczuk that under 40 should not get AstraZeneca?
Sorry, one at a time. Oh, look, what National Cabinet agreed to, which is on the public record, is that GPs would not face any legal consequences if they administered the vaccine to anybody, to make sure that they can administer the vaccine with confidence depending on their health advice. And that's what National Cabinet agreed to. I'm not going to comment beyond that, but to say that if you're under 60 and you want the AstraZeneca, you should have a conversation with your GP. And what the New South Wales Government will continue to do is follow the health advice of the federal regulators. The federal regulatory bodies are the ones that provide advice. So if you want to come through the New South Wales health system, you're welcome. Please come forward if you're over 60. We have nearly 3 million people in New South Wales over 60. We're keen to have all of them vaccinated as soon as possible. But of course, if you've had your first shot of AstraZeneca, please get your second shot. I've had both doses of AstraZeneca and I'm 50. So I'm 10 years off what the current health advice is. But I say to everybody, please follow that advice and please talk to your GPs. And again, on behalf of the New South Wales Government, on behalf of New South Wales Health, can I give a big shout out to our GPs in New South Wales? They've been absolutely amazing during this process and have gone through a lot. It's been frustrating for them. We know many of them have wanted doses sooner. Many of them wanted information as soon as it was available. So I just want to thank our GPs and tell them the New South Wales Government will continue to work with you to support each other in Team New South Wales to provide safe vaccines to our population as soon as we can.
Just to be clear though. Pharmacies this morning are very, very keen to be involved. What's holding you back from enlisting their help?
Nothing's holding us back. In fact, the Minister for Health and I will be making an announcement very shortly about pharmacies in New South Wales, and we want to make sure they have the vaccine available to them, and we'll be having something to say about that imminently. And you can appreciate whenever I use the word imminent, it means very soon. So we'll be making an announcement imminently about pharmacies. But can I also say that I support completely the notion that we should be involving not only obviously our great GP network, who are always on the front line and the main source of distributing vaccines in New South Wales, whether it's the COVID vaccine or any other vaccine, it's always the GPs that are heart and centre to that. Obviously, we've got 100 sites of New South Wales health clinics, and we also have additional hubs that will be coming online, which Minister Hazzard and I will be advising the community on very shortly. And in addition to that, we need pharmacies on board. We also, I think, need to consider, as I've suggested previously, large corporates or large workplaces also having the ability to bring people on their premises to vaccinate their workforces in a timely way as well. Because once supplies increase, and I've said this many times, the challenge now is we don't have enough supply. But once we do have enough supply, we need to make sure there's enough points of access, and that's what we don't have at the moment. And that's why we'll be working really hard to do our bit. And that's why I've been very vocal about GPs having more freedom to be on board as well.
Premier, we're talking about.
Right. I'm sorry.
One of your Adam Marshall has described the rollout as a shambles. Is he wrong?
Look, many people will give their opinion on the vaccine rollout. My job is to give our citizens the facts, and I think I've been pretty vocal on what I think about things and what's needed. But I just want to assure our citizens that the New South Wales Government is doing our bit. We don't control the supply of the vaccine, we don't control the doses, but what we can control is how quickly we get the jabs in arms as soon as we're provided with those vaccines. We can support efforts in that regard, and we can also make sure we impress upon our citizens how important it is for us to get vaccinated. The quicker the majority of our citizens are vaccinated, the quicker we'll be able to have a normal existence with COVID. And I think that's something all of us want to see. And that's something that's been our strategy from day one. Our policy has always been to keep not only the health needs of our population first and foremost, but also the economic needs, make sure jobs are going. But into the future, we want to avoid future lockdowns. And given this additional complication of the very, very transmissible variant, which we haven't seen before in New South Wales to this extent. And if that's to be achieved, we need the vaccine rollout as quickly as possible.
I'll
get to all of you, don't worry.
Queensland claims that they're running out of Pfizer as soon as Monday. How are Pfizer supplies here in New South Wales?
Well, look, we're given about a 4 or 5 week notice period of what vaccines we're getting. So we know roughly what we're getting in the next 4 or 5 weeks. I've had no indication that there's any disruption to what we've been told we're getting. Obviously, the more vaccines we get, the more we can distribute. But I've not heard that from our New South Wales health experts.
Apparently Ryan Parker's calling for...
I'll come to you in a second, yeah.
So now that people under 40 can ask their GP for an AstraZeneca vaccine, in your view, should people under 40 go and get an AstraZeneca vaccine, or should they wait until October or potentially whenever Moderna or more Pfizer arrives? Should people under 40 get AstraZeneca?
The important thing is to follow the health advice. And the health advice says, in New South Wales, if you're over 60, get the AstraZeneca vaccine. If you're under, over 40, we welcome you to get the Pfizer vaccine, which is mainly delivered through our New South Wales hubs, but we're looking forward to more GPs having access to the Pfizer vaccine as well. And beyond that, you need to go to your GP. That is the advice of the federal regulators. If you're outside those age groups, you should have a conversation with your GP, because your GP will need to ask you about underlying health conditions and everything else. It is not important what my opinion is on what the age is. What is important is for all of us to follow the health advice. So if you're over 60, you're welcome to come to New South Wales Health, get the AstraZeneca. Please, no matter how old you are, if you've had the first shot of AstraZeneca, please make sure you get your second dose, because whilst this is a very transmissible strain of the virus, we know the vaccine gives a level of protection, and it's really important for that to occur. If you are under 40 and don't have access, obviously, to either the Pfizer or the AstraZeneca through the New South Wales health system, you should go and have a conversation with your GP.
Are you considering a mass hub?
So Ursula, I promise her next year.
Are you considering a mass hub in Wollongong? We're hearing that we are.
We are, and I'll have imminent details about that. So please know that as I've been calling upon the Commonwealth, is that we need to start doing the work now to make sure we have enough access points to give the vaccine out when the supply arrives. So we don't have the supply we want now, but we're told it's coming. So we need to be ready for that. And that's why, obviously, we're keen to get as many more, I've said to the Commonwealth Government, please open up the opportunities for GPs to do more. They want to do more. They want to have the information in a timely way. We encourage that, because moving forward, that is the way most people normally get vaccinated, through their GP or through their workplace. And COVID shouldn't be any different into the future. At this stage, New South Wales Health, and I'm so grateful to the health team, under all the pressure we're under, we've stepped up and we're doing in excess of 100,000 jabs a week. Remember, we were told you don't need to worry about this. Well, we've said, hang on, we worry about the health of our citizens. We have a sense of urgency. We need to get the vaccines in arms as soon as possible. That's why we're stepping up. And in fact, the very capable person who's in charge of the vaccine rollout in New South Wales advised that yesterday alone, in one day, we did 20,000 jabs through New South Wales Health, which is a great result. So that's, the sense of urgency has always been present in New South Wales. We know that our opportunity to lead a good, normal life whilst the virus is circulating around the world and around our communities is by getting our population vaccinated, and we will do our bit. And I just call on others to do theirs.
Sorry, Premier, you said you want to get jabs in arms as soon as possible, and you mentioned that about 20,000 jabs were done yesterday, the same day that under 40s were told they can go and get AstraZeneca. If you want to get jabs in arms as soon as possible, shouldn't New South Wales Health be offering people under 40 AstraZeneca if they want it?
New South Wales Health will follow the health advice of the federal regulators. The federal regulators have said that anybody over 60 should be getting the AstraZeneca. Now, if anybody under 60 wants the AstraZeneca, you should have that conversation with your GP. New South Wales Health will always follow the health advice. That's what has kept our state strong. I'm disappointed we're in a lockdown situation, but this level of transmission of the virus has forced us into it. But we are already thinking about how we can resume a normal life. We're already thinking about what life after this lockdown looks like. And we know that a key to our success into the future is getting jabs in arms as soon as possible, but as safely as possible. And New South Wales Health and the New South Wales Government will always follow the health advice.
Premier, there's been calls this morning
come back to you in a second,
to stop the Delta variant. There's been calls for our international border to close. What's your view on that?
Look, the issue of international borders and how many Australians come back is a matter for the federal government. But what I've said is New South Wales will always do our fair share, as we've done. We do it without complaint. 50% of people that are coming through Sydney Airport belong to other states, and I'm interested that other premiers are complaining about what they have to do, but it's far less to what New South Wales is doing. But as you know, international borders and how many people come in is a matter for the federal government. All I've been saying from day one is, depending on what that policy is, New South Wales will always do our fair share, because that's the right thing to do. Because not only are we members of the state of New South Wales or citizens of the state of New South Wales, we're also Australians. So we will always do our fair share, but that's not our policy, that's a policy for the federal government. Sorry, I promise.
I know this was touched on yesterday, but have principals now been given a directive to prepare for remote learning, or do you want to see kids back in the
look,
first
we
week?
want to see, obviously we want to see schools back as soon as the lockdown's finished, but of course we have to plan for all contingencies. It's way too early to speculate what that looks like, but as Dr. Chant and I have said in the last few days, because this virus is extra contagious, the settings might be a bit different. So we might be saying, parents, don't go into the school playground. We might be saying, don't have major assemblies. So we're just planning for all contingencies. Please don't read too much into it, but good governments plan ahead. And I envisage face-to-face learning will resume, but it might be a bit different depending on how we go in the next couple of weeks. So please don't read too much into our planning. You'd expect a good government to plan for all contingencies, but it's way too early to speculate on what that looks like. But of course, if it's up to me, we'd like to see face-to-face learning resume as quickly as we can.
Premier,
Sorry, yeah.
So would you consider capping the number of return travellers until we get those vaccinated?
Well, that's a decision for the Commonwealth. The federal government decides how many Australians are returned back. They decide which Australians are let out of the country and which Australians are let back in. All I've been arguing from day one is that every state should do its fair share. We do it without complaint. We do it with the risks, and we know the risks are there, but we have to follow what the federal government decides in terms of international borders. I'll come back, but sorry, yeah.
Do you think it's fair for the other states just to say, look, we want 80% of the population vaccinated before we start lifting the amount of return?
Look, these are conversations that we'll continue to have. What I do know is that we need to have a sense of urgency in the vaccine rollout. Anybody who says or thinks we can lay back and just be pretty easy about this is not looking at all the opportunities we have about living a normal life into the future. What is best for our state and what is best for our nation is to get as many jabs in arms as quickly as possible to reduce the risk of the virus spreading in the community into the future. And whilst this variant is extremely contagious, I hope we don't get even more contagious variants down the track, but we need to be prepared for all things that could come up. None of us would have anticipated how contagious this variant was or the impact it would have. And certainly we need to prepare for all scenarios moving forward, but the best way to prepare, the best way to keep your economy open, but to keep your community safe, is getting your population vaccinated. And that's why I hope people look up what we've been saying in New South Wales for months and months about a sense of urgency, and that maintains. If anything, our sense of urgency has only gone up to get as many jabs in arms as quickly and as safely as possible. But we also have to follow the health advice on what is a safe way of getting those jabs in arms. And New South Wales Government will always give that advice to our citizens.
Maybe can we just get an update on the Lake Macquarie hub?
Oh, look, nice try. You'll get an update on those hubs imminently. In fact, okay, I'll let the cat out of the bag. We will be talking about some additional opportunities tomorrow in relation to additional points where people can get their vaccination across the state. And the Minister for Health and I will talk about that tomorrow.
About the vaccine rollout, Dr. Chant. The Queensland Chief Health Officer, your counterpart in Queensland, basically said today that AstraZeneca is more risky for an 18-year-old than getting coronavirus. She's saying that she doesn't want an 18-year-old to get AstraZeneca when if they got COVID, they probably wouldn't die. Do you share those views that Jeanette Young has, that AstraZeneca is more risky for an 18-year-old than COVID?
In response to that question, I think the ATAGI is the group that we need to respect the advice. And just to be clear, what ATAGI has said is that the preferred vaccine, that over 60s can get both vaccines, but for those under 60, the Pfizer is the preferred vaccine. The reason we are prioritising Pfizer rollout in our system is because there is limited access to AstraZeneca through, there is limited access to Pfizer throughout the state because of the particular ways in which it has to be managed. We're looking forward to the fact that as the supplies get increased, we're looking forward to the fact that more GPs will also have access to Pfizer, and clearly that's also been flagged that other vaccines will be accessible by pharmacists. However, in terms of AstraZeneca, it is important that ATAGI has said that people can make personal choices, but they need to be informed. And the view I have is that in a mass vaccination clinic, the detailed risk discussions cannot take place, and they are the best discussions to have with your general practitioner. Transparently expressing the risks and benefits. There may be unique circumstances that a person is concerned about, and individuals have the right to make those decisions, but they must be fully informed. And that is why we are providing AstraZeneca to over 60s, where the risk-benefit ratio is much clearer in favour of AstraZeneca because of the impact of COVID. But for younger people, we really encourage you to go to your GP and just discuss your particular circumstances and have that discussion. That's not the setting we think should happen in a mass vaccination clinic. We have a lot of tasks about scaling up our Pfizer access. We will be an important access route for Pfizer, and that's the appropriate focus whilst we have good access to AstraZeneca through GPs and patients of GPs. GPs know the family history, they know that the particular circumstances. They are best to have those very detailed discussions about risk and benefits.
Dr. Chan, just on the nurse, just a few things to clarify. Do we know where she picked it up? And did she work at Liverpool Hospital as well? And how many patients has she been in contact with?
So she's worked at Fairfield Hospital and also Royal North Shore, not Liverpool. The source of this patient is not clear at this stage. We do know that a household member is positive, and we're also testing another household member, and we're doing repeat testing on that other household member. As I've indicated before, sometimes the direction of transmission is sometimes very difficult to understand, so we do need to do a few tests around the person. And then obviously we will do what we do with everyone. Once we find out who perhaps was the first case, we go back and look at the 14 days prior, who they were exposed to and what their source. So those investigations are happening apace. In the early hours of this morning, the real focus was keeping our patients and staff safe. And so immediately staff who had contact with the student nurse were identified, ensured that they were not on duty. Testing was arranged. We ensured that discharged patients were contacted and testing set about for those. Obviously, we'll update you and keep you apprised of should there be any different change to any public health advice arising from this infection in this individual, including the source of her infection.
How many patients?
So we've indicated 5 days, and as I said, we're very cautious. Our guidelines actually take a more cautious approach when people are infectious, and so we have a requirement where we go back even 3 days prior to onset of symptoms. And it is important to do so because obviously we want to take a very cautious approach when we're dealing with healthcare exposures.
How many patients? I'd like to ask you specifically about Minister Dominello. He was a close contact, now is not a close contact. What was the basis behind that decision, letting him out of 14 days in isolation?
Can I just say the process, I don't think we've dealt with such a complex workplace site as Parliament House, and I know many of the media are in that environment. There's exposures in the chamber, exposures at functions, exposures in rooms, exposures in lifts, exposures in stairwells. It is a complex place where a lot of people are moving around. Our public health officials developed a risk framework that identified factors that would take into account their risk assessment. One of the unique circumstances that was taken into account was the fact that Mr Marshall's exposure was pretty well characterised in terms of the cafe, so the timing of exposure was pretty clear. He also promptly went for testing on the Wednesday. As soon as he'd woken up, I presume to the text message he received, he immediately got tested. So we had a result from that morning at 7:45 a.m. Now that test result showed that his virus levels were very, very low at that time, to the extent that we actually repeated the test on him later to confirm that he had virus present, given the significance of the exposure setting. We also convened an expert panel, and that expert panel said that they could not, that they were unable to exclude that he could have been infectious from 7 a.m. The exposure was 7 p.m. the next day. So that was on the Tuesday. His exposure was on the Monday night at 7 p.m, where he crossed over an infectious case. But that it's likely the infectiousness increased throughout the day. And if he was going to be infectious at all on the Tuesday, it was more likely towards the latter part of the day. The other considerations were around face-to-face contact, the distance from them, the nature of that contact, whether it was front-facing, so faces to the individual versus back. So our public health team developed a matrix and applied it, interviewed a number of people, and also clarified it, because people, we reviewed CCTV footage, new information came to light. It was actually quite complex, but let me tell you, it was done by the public health practitioners, and there is going to be people that fall one side of the line or the other. And we have to draw the line somewhere, but I urge everyone to comply with the allocation they've had, follow the isolation requirements for 14 days. But even if you've been designated as a casual contact, you're subject to other requirements. And also, if you have the most minimal of symptoms, I urge you to get tested.
Minister Dominello has posted that he got a personal phone call to tell him that he went from a close contact to a casual contact. Is every person in New South Wales in the same situation getting a personal phone call to tell them that they are now a casual contact?
We usually take the first tact, and I've not apologised for this. We often do either a stop and stay, and that's when any venue comes in, because we want to get out there before we've assessed it. We ask people to do a stop and stay, or basically isolate until we get back to you. That's a holding pattern until we can do those risk assessments. And then what happens is our close contact tracing team will actually ring you. So for instance, as an example, just to explain the complexity, say we have a case at a gym. We don't know, and unfortunately people don't check out. This is a real problem. So people check in, but they don't check out. And so when we might take, say, someone would probably have maybe been at that gym for 4 hours or 3 hours, we make an estimate. And so what we do is we identify a large swag of people who were there that day, and then we ring them and say, could you tell me what time you exited the gym? Did you go to work? Are you really sure about that? And if there was no crossover with the case, we say, actually, you weren't exposed. And so it is a movable feast. And sometimes we announce it publicly when there's been, we've just advised stop and stay and await public health advice. They will usually get a text, or the close contact tracing team will work through it.
Minister Hazzard. Sorry, two quick questions if I can, Minister. First of all, Anna Coffey is getting a charity charter flight to Melbourne to see her father.
Dad.
Is there a need for a national approach to these end-of-life cases to avoid unnecessary anguish and confusion?
Each case is very different, and certainly from our point of view here in New South Wales, we have taken steps. We have a whole team that looks at these situations, but also in the end it can come to me as Minister, and I have intervened on quite a number of occasions over the last 15, 16 months. I did actually speak to Anna yesterday afternoon, I think on a couple of occasions, and was satisfied that in all the circumstances, a very compassionate approach should be taken. In fact, I personally spoke to Martin Foley, the Victorian Minister, who was equally inclined to be as compassionate as possible, but it's a balancing act. As Dr. Chan has talked about many, many times, trying to strike the balance between keeping our community safe and looking after individuals is a challenge. But I'm not sure, I did see the comment from someone or other that the National Cabinet, AHPPC might be asked to look at it. Well, AHPPC can certainly be asked to look at it, and they may come up with some guidelines, but I suspect that even with national guidelines, cases are so varied and so individual that it will require, in the end, the personal touch to be able to look at it.
And can I also ask just why rapid antigen tests aren't being more widely used? We've seen them used overseas to screen passengers getting onto aircraft, going in and out of aged care facilities, but why we're not seeing a wider use of rapid antigen testing here?
Dr. Chance answered that question probably a couple of hundred times in the last couple of months, but essentially rapid antigen testing is suitable in certain circumstances, but it has to be weighed up in the sense of the accuracy of it. It's slightly less accurate than obviously some other tests, but it's certainly in the broader ambit. You've got to weigh up a proportionate response, a proportionate decision in terms of what are the bigger risks. Do we need to get a fast result here for other reasons? And as just the range of issues over the last 18 months, I can remember at various stages it's been an evolving situation. This is a pandemic that has evolved in every way, and certainly at various points we didn't have anywhere near enough of various tests. And in fact, the pathology that has been developed, I want to do a call out to our pathology services here, our government, New South Wales Pathology, but also the private laboratories. They have all stepped up, and the range of pathology services, the fast turnaround, the accuracy, have all improved out of sight. So I just want to thank them for all the work that's done. It certainly made it a lot easier for us, that is for the health team, to make proportionate decisions and responses as new circumstances arise.
Deputy Commissioner, these Sydney travellers that went to Dubbo, 76 of them, you've fined the travel company $5,000. Will you issue everyone a $1,000 fine? Is that not a $76,000 sting?
There was a discussion about that very aspect of the investigation this morning. If you look at the circumstances where those people hopped on that bus prior to the public health order, and were essentially in the custody of that company, to actually then have those people make conscious decisions to hop off that bus, grab their luggage and find their own way back to Sydney, I think that where we'll arrive at in the discussion is that the infringement notice to the company